Bienvenue tous. Welcome to Reporters here on France 24. In this edition, how Egypt is trying to beat the disease hepatitis C. A mass screening operation is underway, billed as the biggest in the world. Egypt is aiming to identify the extent of hepatitis C infection throughout its population. And it's already been established there are some 140,000 new cases every year. Hepatitis C is a blood-carried disease. It can cause scarring of the liver or cirrhosis, if left untreated, even death. Transmitted by blood-to-blood contact, that could be unprotected sex, dirty medical equipment, shared needles. Let's bring in now our reporter, Eric de la Varenne, who's our reporter, Eric in Cairo, of course. Eric, tell us more about the origin of this health crisis. It's already one of the biggest scandals in Egypt's modern history.
Yes, you need to go back to the root of this epidemic. In the 60s, Egypt faced a veritable scourge of bilharzia, a disease that's transmitted by a Nile worm. It attacks the liver and killed hundreds, even thousands of people every year. At the time, President Nasser decided to tackle the problem with a nationwide vaccination campaign, except that the needles circulating then weren't sterile and were often used for more than one patient. And that's how, through contaminated blood, Hep C spread across the country. The aggravating factor is that it took until the 90s and the discovery of this Hep C epidemic for authorities to understand what had happened.
Eric, thank you very much indeed. Eric de la Varenne's film then begins with a call to screening in Egypt.
حملة المليون صحة المواعيد من الساعة 9 صباحا حتى الساعة 3 مساء.
Since October, calls to be tested for hepatitis C have reverberated across Egypt. In mosques, churches, subways, hospitals, and mobile clinics, more than 7,500 screening centers have opened throughout the country, many here in the capital, Cairo.
Now I'm going to start testing for hepatitis C. Don't be scared, it's just a little sting. There's nothing to it. Here, I'll leave the test here for 20 minutes and then we'll have the result.
The government is hoping to carry out the largest medical screening campaign in the world. Its goal, to eradicate hepatitis C in Egypt by 2020. This is Kafr al-Sheikh, some 140 kilometers north of Cairo. To make sure no one is missed, Dr. Hisham and his team go right into people's homes.
We would like to test you for hepatitis C. We go from house to house to tell people that there is a national screening campaign for hepatitis C and lesser-known diseases too, such as diabetes or high blood pressure. Things that patients might discover for the first time that they might know nothing about. We explain all this to them and give them the results right then and there.
To make sure no one is left out, Dr. Hisham and his team search for new patients wherever they can.
Come this way, madame.
You won't hurt me?
Not at all.
In this agricultural region of the Nile Delta, the disease is especially widespread in people over the age of 60. 1 in 3 is affected by the virus. The problem dates back to the 1960s, when bilharzia, a parasitic disease found in the Nile, infected millions in Egypt, a country where 9 out of every 10 people live near the banks of the river. In response, President Nasser launched a massive vaccination campaign. Saad al-Hanna was around 10 years old at the time. She says she still remembers.
We all went to the clinic to receive injections, and after the injections we took tablets for bilharzia. We went there before breakfast because the first injection had to be made on an empty stomach.
The vaccination campaign had dramatic consequences. At the time, unsterilized syringes were reused repeatedly on the lines of people queuing up to receive injections. Hepatitis C, transmitted easily by blood, was spread across the country. Like millions of Egyptians, Saad is the victim of one of the greatest health scandals in modern history. Through gross negligence, a government managed to infect millions of its citizens with a disease that can prove fatal if not treated in time.
My son took me to do some tests. The results showed that I had hepatitis C, and they told me that I now needed someone to help me. I cried and told my son that I also had hepatitis C. I have had so many diseases in my life.
In Egypt today, social services are often short of funding. The residents of this village look out for each other.
Do you take your treatment regularly?
Yes, thank God.
Do you go to Kaf Khail Sher to receive the treatment?
Yes, we go every month to get the treatment.
Do you get it for free or do they charge you?
No, it's free.
Millions of Egyptians infected with hepatitis C are now being referred to health centers. Abdelmagoud Ibrahim discovered a week ago that he was carrying the virus. And like so many patients, he has trouble comprehending how this happened and what it means.
How did I get it? From food? From drink? Or my own negligence, such as smoking and things like that? I don't know. What I heard is that it causes cirrhosis of the liver. And to be honest, I don't really understand what that means.
The government estimates that less than 5% of Egypt's population of 100 million are infected. But specialist doctors believe the situation is worse.
The numbers are very large. On average, it is about 10% of the residents, as the organizations have said. It's a large percentage.
This is your prescription. You're going to fill it at the pharmacy.
It has nothing to do with food. The most important thing is to take them at the same time every day, even if you haven't eaten. With regards to food, stay away from fat and eat raw foods, and stay away from hot sauce, spicy, or overly salty food. I do not know what the price is of this treatment abroad, but here in Egypt, it's at the state's expense. All these drugs are free.
They're free because in 2014, Egypt took a bold step. Facing up to a health emergency, the authorities took on the pharmaceutical industry. Egypt now manufactures its own generic drugs. The cost of a 3-month treatment, 220 euros per person, 100 times less than in France. The Egyptian state can now treat its population at low cost. But for some, it's already too late. In Alexandria, Islam Farouk's whole life changed overnight.
I was a very good student, and everything after that changed dramatically. I didn't know why then, but I felt my health was not good. It took for me about 12 years to know the reason of my health condition, but in the end I found it, and it was vaccinate.
Islam lives with this disease, which attacks the liver. Untreated, it can cause cirrhosis and cancer. He's avoided the worst, but hepatitis C has irreversibly affected his health.
I feel pain in my body right now, and it increases with effort and making effort, and it leads in the end for me to sleep or stop working at all, get rest for a lot of days. Okay.
Islam relies on his mother for daily support. They live together in this small apartment.
My sickness made me a prisoner at home most of the time. I can't go outside, or it is like I will suffer more after that.
Islam is convinced that he caught the virus at the dentist's. 50 years after the initial scandal, the problem of unsterilized medical equipment still exists. Researchers at this NGO investigate conditions inside Egyptian hospitals by posing as patients.
فانتوا في الاخر لازم تعيشوا التجربه دي عشان يبقى في الاخر التقييم للافاده اللي احنا بندور عليها. بعد كده هيدخل المدخل، بعد كده هيروح الاستقبال، عشان الاستقبال هو اللي يدله لو هو عايز يروح لمكان معين. هيروح منطقه الانتظار بتاعه العيادات الخارجيه لما هيحجز الكشف. المفروض المقيم المثالي يعني هيعدي على كل ده. Because we have problem with infection control and it's not quite applied in all hospitals in Egypt. We sometimes may acquire virus like hepatitis during blood transfusion. We have these sort of problems, of course.
Rehem Saber has just received her assignment orders. To avoid any trouble for the NGO, the survey sites will remain confidential. But in this hospital, for example, the sanitary conditions are poor. Garbage cans line the corridors. Behind the building, syringes litter the ground. The conclusions of Rehem Saber's investigation are clear.
Many hospitals don't have sterilized equipment in the examination rooms. In some clinics, doctors don't even wear gloves. And some don't even ask for the medical history of patients before issuing prescriptions. When it comes to hygiene, the level of cleanliness is not very high.
The focus is on treatment, but not on prevention. Widespread poor hygiene practices and a lack of awareness of the disease are hindering its eradication. The battle against hepatitis C is far from won. Every year, 140,000 more people are infected by the virus. Tour and Cure is a new initiative that aims to treat patients with hepatitis C from Europe or the United States while also offering them a holiday.
Has happened.
Football superstar Lionel Messi even participated in the promotional campaign.
102 goals with his team's help.
In the souks of Old Cairo, the director of the program prepares for the arrival of the first group of Tour and Cure visitors.
We're receiving the first 250 patients coming from England and other places in Europe this summer. We have provided them with a travel plan that they can have 5 or 7 days with containing the treatment of hepatitis C in internationally approved and authorized hospitals.
This famous restaurant in the Old Town is part of the tour.
Can you walk through so you can show it? Oh, very traditional. I'm pretty sure that the patients will really love it.
For Europeans, a major incentive for such a trip is the low-cost treatment.
Well, actually, this is the treatment for the hepatitis C. It costs very little money here in Egypt. In Europe, it's anywhere more than 25,000 euro.
Egypt offers these trips for 4,000 euros, including treatment. A bargain for many patients, especially in the UK, where funding is not the only problem.
There are really a long waiting list for people who want to be treated, or actually, they have to reach the stage 4 of cirrhosis of the liver.
With its new health campaign, Egypt hopes to erase past mistakes and share its expertise in the fight against hepatitis C around the world, especially in Africa. The disease still kills an estimated 400,000 people globally every year.
Our reporter Eric Delaronde is still with us. Eric, thank you very much for that fascinating film. The campaign against hepatitis C is successful so far, but there is still a lot of work to be done.
Yes, there are still some basic issues. While it's launched this medical drive, the Egyptian government hasn't accompanied it with any sort of information campaign to explain how to prevent the virus from spreading further, how people can protect themselves. And to give you just two examples of how important it is to communicate on this issue, street barbers here in Egypt use the same blade for more than one customer, and cut-price dentists often treat patients with badly sterilized equipment. So it's that vital need for information that this World Health Organization doctor referred to when we went to meet him in Cairo.
A problem? We need all stakeholders to take their ownership to improve their practice. Implementing injection safety policy, using of safety engineered devices by 2020 will add a lot to the safety environment at healthcare institutions, as well as causing mass screening and treatment of people living with HCV will dramatically decrease the incidence. So all together need to be accompanied by correct and aggressive communication plan to inform people about the mode of transmission, about the preventive measures, to ensure no one will acquire infection after treating the mass treatment of the people.
Ala Ashish of the World Health Organization. Eric's still with us, of course. Millions of people in Egypt becoming infected then with hepatitis C because of basically state incompetence, and that was widespread. I'm wondering if these people have been in any way compensated for what happened to them and how their care has been paid for.
Well, the compensation is basically this free treatment drive, a state-sponsored campaign for all Egyptians. As for the possibility of taking legal action against authorities, that's quite simply unfeasible in a military state. And given that the outbreak dates back to the 60s and wasn't detected until 3 decades later, it would be far too complicated to allocate blame, especially as most of the political leaders of the time have passed away since.
Eric Laverne, thank you very much indeed. And if you'd like to see Eric's film again, fascinating, it really is, isn't it? You can see it, of course, via our website, www.france24.com. You're watching Reporters here on France 24. Stay with us.